In this video, we're going to be talking about the medication Propranolol. It's a medication that's been around for a while, it has a lot of different uses. So we'll go over the different most common uses, what side effects you need to watch out for, and the big black box warning that everybody taking this medication needs to be aware of. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. If you think this would be something helpful to you, make sure you subscribe, hit that notification button, and follow along with us. Well, in today's episode, we're going to be talking about Propranolol. It's a medication that was first patented back in the 1960s, so it's been around for a long time. And throughout all these years, we found a lot of uses for it. It belongs to a class of medications called beta blockers. These are a group of medications that work on specific parts of the body, including the heart and blood vessels, that among other things decreases how fast and strong the heart is beating and helps the blood vessels to relax. It's through these different mechanisms that it's able to help in so many different ways. So we're going to go over some of those common uses, and then after we'll talk about the side effects, as well as other issues you need to watch out for with this medication. So the first area that Propranolol was originally designed to help with is the cardiovascular or heart system. It's used to treat high blood pressure and conditions where you get an irregular heartbeat like atrial fibrillation. It can be used to treat certain kinds of chest pain caused by heart disease, or even at the onset of a heart attack to help prevent further damage, or sometime after a heart attack to prevent further events. By slowing down some of the stimulus that's going to the heart and blood vessels, this medication is able to decrease how hard it is working and allows the blood vessels to relax. This can have a lot of protective effects on these conditions. Now, there are a lot of different medications that we use that are a bit better for these conditions, so we don't use them quite as often as in the past, but they still can be a good option in certain situations. But that same effect carries over to another condition that we use this medication for, and that's to treat something called esophageal varicees. These are blood vessels that dilate in the esophagus. They're basically like varicose veins in your throat, and they develop when somebody has issues with their liver, most commonly something like cirrhosis, where the liver scars down and isn't able to filter blood through as easy. Because of that, the blood backs up and increases the pressure in the main vein that supplies the liver. And as that backs up, those blood vessels dilate, and if they get too bad, they can burst. If that happens, it's not a good thing, and you can die very quickly. So we use Propranolol to help decrease the pressure in that area and help prevent those from getting worse. So Propranolol was originally used to treat mostly these types of heart and blood vessel issues. But as time has gone on, we've found that there are several other conditions that are effectively treated. These are actually the conditions that we tend to use this medication more commonly for. Now, one of the most common reasons we use this is to treat certain types of anxiety. It seems to be most effective in helping those who have significant anxiety with situations like public speaking. Just like any medication, it doesn't help for everybody, but many can and do really well with taking a little dose about an hour before a stressful event like public speaking. It just slows that heart rate and shaking down enough to help somebody get through it. We do use it occasionally for general anxiety type symptoms as well. So those whose anxiety seems to present with a little more racing heart rate, shaking, and feeling on edge, it really can be worth a try. Now, the next condition that we use it for is a condition called benign essential tremor. This is a problem that tends to happen more as we get older, where we can get a shaking tremor, especially when we're trying to do things such as write or hold things. It's not related to conditions like Parkinson's, but it can be quite bothersome. Now, we also use it to prevent frequent migraines. We think one of the causes of migraines can be spasms of the blood vessels in the brain. In some people, Propranolol can be an effective way to help prevent those spasms and decrease how often and severe headaches are. The last condition that I'm going to talk about is one we call hyperthyroidism. This is when, for whatever reason, the thyroid is producing too much. It can cause a lot of problems when it does. It can cause you to have a very rapid heart rate and feel really on edge. So one of the medications that we'll use to help prevent the body from all the symptoms of excessive thyroid is to give some Propranolol. We'll often do that while we work to fix the underlying issue. Well, so as you can see, there are many different issues or uses of this medication, and we didn't even go into them all. But no matter what reason you're taking this medication, the side effects and the issues that can happen with them are the same. So let's get into some of those. The most common issue that we see with this medication is related to its effect on the heart and blood pressure. The biggest thing that I warn people about while taking this medication is that it may work too well. Your blood pressure can go down or your heart rate can go low. This can make you feel really sluggish and tired, or even dizzy or lightheaded if your blood pressure drops. You may notice that when you stand up too quick, you can get that head rush kind of a feeling. Now, another group of people that need to be careful while taking propranolol are those who have asthma. Being a beta blocker, this medication can affect some of the receptors in the lung and make asthma symptoms worse. And it can also counteract some of the medication that we use to treat asthma and make it a little less effective. So if you have asthma, you need to work really closely with your doctor if you're on this medication. Now, apart from those, we can see side effects such as fatigue, insomnia, nausea, diarrhea, some hair loss, and occasionally some impotence. For most, these symptoms, though, they tend to be short-lived and often will go away after a few weeks, or can simply be improved by just a change in the dose. Of course, some may always have some significant symptoms, so as with any issue with any medication, if you're having a lot of side effects, talk with your doctor about it and see what they recommend. Now, more significant reactions can include worsening heart failure, very low heart rate, worsening of asthma symptoms, allergic reactions, changes to blood counts, and worsening of a Raynaud's type symptoms where your hands get cold, white or blue, and painful when exposed to the cold. Now, propranolol does come with something called a black box warning. This is a special advisory about a significant concerning effect that a medication can have. The black box warning for propranolol warns against stopping this medication abruptly in those who have underlying heart disease. The concern is that those who have severe underlying heart disease who stop it suddenly can have severe worsening of chest pain that can lead to a heart attack or severe heart arrhythmias. So what this means is that if you are on this medication, you shouldn't stop it all of a sudden. When coming off this medication, it's important that you taper down off of it over a couple-week time frame. Now, this certainly isn't a common problem. However, it is important to be aware of. This mostly affects those who have severe underlying heart disease. And most people know that they're in this category, but it's possible you can have this underlying disease and not know it yet. For that reason, we just recommend that everybody who is on it taper down off of it slowly if they need to stop it. Also, propranolol can be an effective medication for just several different things. It can be used to treat high blood pressure and different heart conditions. However, nowadays it's used most commonly to prevent migraines, treat symptoms of anxiety, tremors, or symptoms related to a high thyroid. It can be an effective tool when used under the close care of a doctor. It's important, though, to know what to watch out for while taking it. So hopefully through this you've been able to understand a little bit more about this medication and feel comfortable taking it under the recommendation of your doctor. Well, I hope you found this information to be helpful. If you did, please take the time to give this video a like and share it with your friends. It helps our channel to grow and reach other people that may need this in their life. And if you haven't done so yet, don't leave without subscribing and hitting that notification button so you don't miss out on any of our future content. But until next time, this is Family Med with Dr. Richardson, and remember, take care of your body because it's the only one you have.